Good afternoon. I'm Mike Cummings, and I'm going to be talking about the green leafy vegetable that's not too good for you, which is tobacco. And I guess, if you come here 25 years ago, this room probably would have been a blue haze. So we've made some progress, and my message today is pretty simple. We've got a long way to go yet if we want to actually achieve the goals of a smoke-free society, as it was articulated almost 25 years ago to the date by C. Everett Koop back in 1984. What are those benefits? I think we all know what they are, but hundreds of thousands of premature deaths from cancer, a third of all cancers due to smoking, heart disease, COPD, savings of billions of dollars now diverted annually to pay for the illnesses caused by tobacco. So the fact of the matter is governments can't really afford any longer to be footing the bill for the burden that comes along with tobacco. Each year, we collect about $1 in taxes on tobacco for every dollar we spend to treat the people who are sick from smoking. The solution to the tobacco problem isn't complicated. The solution lies in changing incentives for tobacco use, changing the behavior of the tobacco industry to prevent it from acting in ways that counter the goals of public health. And what the Robert Wood Johnson SAPRI research program has demonstrated over its 20-year history is that tobacco control interventions that have the greatest chance of reducing the demand for tobacco in the population are those that reach the most people. So highly effective interventions that just reach a handful of people, it's not going to make much difference. The research that makes a difference are the ones that reach out into the population, and they include policies like raising the price of smoking through taxation, comprehensive advertising bans, pack warnings, mass media campaigns, and smoke-free policies. Now NIH, their research on tobacco has in the past, and probably today, tends to emphasize the biological mechanisms by which tobacco use causes disease, and the implications this research has for developing treatments for those diseases. Now, I work at a comprehensive cancer center, and I fully recognize that that work is critically important. It gives hope to those who are afflicted by the illnesses caused by tobacco. However, the most beneficial effort in the next, particularly in the short term at least, will come from research that maximizes the effectiveness of population-based interventions that are already known to discourage tobacco use. Let me just say it clearly. The focus on population-based interventions has far greater potential there you go, to reduce tobacco-caused disease over, you see there's darkness already coming in on this. Let me say it clearly again. The focus on population-based interventions has far greater potential to reduce tobacco-caused disease over the coming decades than all biomedical advances put together, and a fraction of the cost. So these interventions include policies that governments can introduce, are not necessarily complex, but their effective implementation really will define how successful we're going to be over the next few decades. So maximizing the effectiveness of these interventions will require marshaling the best behavioral and social science research there is to ensure that the interventions that do get adopted are as effective as possible and are disseminated appropriately. The need for the strongest possible evidence is made even more important with our knowledge that the tobacco industry is, of course, out there working to support policies and interventions designed to promote tobacco consumption. So over the next few years especially, it's critically important for us to amass a strong body of evidence for rigorously conducted evaluation studies of tobacco control policies in order to provide true evidence-based guidance to governments regarding what kinds of interventions are the most beneficial. So some of the critical policy domains are shown on the slide here behind me, which you probably can't see, but they're also described in detail in this briefing book, so I encourage you to take a look at that. Let me just highlight a few of the items. One of the most significant tobacco control policy measures implemented over the last 25 years occurred this year when Congress voted to boost the cigarette tax by 61 cents per pack to help fund children's health insurance. Sounds like a good use of the money. This is the single largest federal tax on tobacco to date in our history. Now, while some politicians might cringe out there at the thought that any tax is worthwhile, previous SAPRI-funded studies have shown us that tobacco taxes, when they go up, smoking rates go down, particularly among kids. However, what is unknown is what happens when such a large tax increase goes into effect. These are sort of the things we need to know. You know, has the tobacco consumption in response to the 61-cent tax increase gone down proportional to the price? Was it bigger? Was the effect even greater? Or was it less? Are the effects the same across all demographic groups? How is the federal tax impacted tax revenues that are collected at the state and local level? How has the tobacco industry, of course, responded to the tax hike? Has the sale of contraband tobacco increased? How are governments addressing contraband sales? What policies are working and which ones should we toss out and get rid of because they're not working? Another important federal policy initiative is the Family Smoking Prevention and Tobacco Control Act, which after a decade of debate was finally signed into law this past June. This law gives the FDA authority to regulate tobacco products in ways that are intended to better inform consumers about tobacco products, limit marketing practices that confuse consumers, and regulate products in ways that reduce their appeal, their addictiveness, and their toxicity. Sounds great. Research is needed now to critically assess how this law is going to work and to find out ways that we can maximize it so it achieves its potential. Recent consensus reports from all kinds of organizations, I'll name a few, WHO, the Surgeon General, the President's Cancer Panel, the Institute of Medicine, and even an NIH consensus conference on tobacco, just in the past 5 years, have noted the importance of investing in research to find ways to speed up the adoption of effective tobacco control policies. Yet tobacco policy research, the type of research that we know from the research that's gone on through this program, would lead to rapid reductions in tobacco-caused disease, is hardly a blip on our funders' radar screen today. The sad situation today is that most addicted smokers who make a quit attempt do it without receiving any treatment, even the treatments we know that will make a difference in helping them stay off of tobacco. The situation is akin to treating someone with cancer with advice to tough it out. This, it's really unacceptable. So while I would support the need to invest in more research to find better treatments to help people break their addiction, equally important, perhaps more important, is to invest in the kind of research that will get the treatments out to people so there's a demand and use of those treatments so they benefit from them. We know what governments can do to reduce tobacco use. We've seen it done in California and New York City. What happens there? Smoking rates are plummeting, and cancer rates and other disease rates from tobacco are going down rapidly as well. So why aren't governments doing it? Because they're not. Frankly, it's an embarrassment that we are nowhere close to achieving our national health objective of reducing tobacco or cigarette prevalence to 12% by the year 2010. We're not going to make it. We're going to miss it by a large margin. Low and middle income countries around the globe, like Thailand, are doing more to combat tobacco use than we're doing right here in the United States today. With so many lives at stake, it's unacceptable to dismiss our national public health objectives as meaningless rhetoric. We need to invest in tobacco policy research now to help guide those entrusted with the responsibility to protect the public's health. Especially at a time when Americans are debating health care reform today, I hope that the material that's provided in the briefing books in front of you will persuade you that tobacco policy research should be at the top of our priority list. Thanks very much.